Hi, I'm Dr. Shahid Latif, consultant adult psychiatrist. Today we're going to be talking about something many people are wondering. Why does it seem like ADHD diagnoses are increasing? Are more people actually developing ADHD, or is it something else happening? It's important to understand that the rise in diagnosis doesn't necessarily mean there's an actual increase in the prevalence of ADHD itself. Several factors contribute to the perception of this increase. First, there's greater awareness, and ADHD is now more widely recognized and discussed. There's increased media coverage, and public education campaigns have helped people understand the symptoms and seek help. This means that individuals who might have underdiagnosed in the past are now being identified. Secondly, diagnostic criteria have evolved over time, and the criteria for diagnosing ADHD have been refined. We now have a better understanding of how ADHD presents in adults, not just in children, and this may lead to more adults being diagnosed who might have struggled for years without knowing why. Third, reduced stigma plays a role. Mental health in general is becoming less stigmatized. More people feel comfortable seeking help and discussing their struggles. This openness encourages individuals to get assessed for conditions like ADHD, which they might have avoided in the past due to fear of judgment. Fourth, better assessment tools are available. We have improved diagnostic tools and assessments, making it easier to accurately identify ADHD. Standardized questionnaires, clinical interviews, and cognitive testing help professionals make more informed diagnoses. Fifth, environmental and social factors may contribute. While not the sole cause of modern life, these can exacerbate ADHD symptoms. The constant stimulation from technology, increased demands on attention, and fast-paced environment can make it harder for individuals with ADHD to cope. This might lead to more people to seek help, even if the underlying condition has always been there. It's also important to note that overdiagnosis is a concern. With increased awareness, there's a risk that some individuals might be misdiagnosed. That's why thorough assessments by qualified professionals is crucial. In summary, the rise in ADHD diagnosis is likely due to a combination of factors: increased awareness, improved diagnostic criteria, reduced stigma, better assessment tools, and the challenges of modern life. If you suspect or someone you know might have ADHD, it's important to seek professional assessment at the Health Suite. We can help provide clarity and support.